Hello everyone, I am Ismail Gestopa and I'm a family nurse practitioner. For this video, I will be discussing the medication known as vortioxetine or Trintellix. Considering that I mainly work with patients who are in nursing homes and assisted living facilities, my primary audience will be adults aged 55 and above. For this age range, medication adherence can be a challenge because of limited health literacy and/or instances of missed intake because of having to also take other medications for other conditions. By providing a comprehensive yet easily digestible medication education for its target patients, the likelihood of medication non-adherence can be decreased. What is the usage of vortioxetine or Trintellix? Trintellix is one of the brand names of the antidepressant vortioxetine, which is prescribed for patients diagnosed with major depressive disorder or MDD. Initially, this was known as Trintellix, but in 2016, Takeda Pharmaceutical USA changed the name to Trintellix so as not to cause further consumer confusion between the old brand name Trintellix with the blood thinner known as Brilinta. Now, what are some symptoms of major depressive disorder? There are several symptoms of major depressive disorder as listed in the Diagnostic and Statistical Manual of Mental Disorder 5th edition or DSM-5 of the American Psychiatric Association, and there are depressed mood most of the day and week, loss of interest in most or all of one's usual activities, frequent fatigue, frequent feelings of worthlessness, and thoughts of death in general, or even suicidal attempts. Now, what is the mechanism of action of the medication Trintellix? For patients, especially those who are being prescribed with Trintellix or vortioxetine for the first time, the mechanism of action pertains to the effect or effects that the drug produces inside one's body. Vortioxetine itself is being considered as a replacement first-line agent or subsequent therapy for patients who did not have positive outcomes with other antidepressants. Now, what are the targets? Vortioxetine means pharmacologic targets are one's serotonin receptors and transporters. This concern a number of biological functions such as eating, sleeping, and thinking. Serotonin itself is commonly known as one of the happy chemicals. It is a neurotransmitter in the brain that maintains mental balance. Now, for the dosage, the recommended therapeutic dosage for vortioxetine ranges from 5 to 20 milligrams, and it must be administered once a day. What is the classification of Trintellix or vortioxetine? Trintellix or vortioxetine is primarily classified as a miscellaneous antidepressant, which increases serotonin levels in the brain. Now we have the side effects and patient safety. The most common side effects of Trintellix or vortioxetine are constipation, nausea, and vomiting. And with caution, it is vital for a healthcare provider to thoroughly go through a patient's medical history, especially if the patient is pregnant, before proceeding with the treatment using Trintellix or vortioxetine so as to ensure that the patient does not experience adverse reactions. For the on-label and off-label use. If a healthcare provider prescribes a drug in accordance with how it was approved by the FDA, then it is on-label. And if the healthcare provider deviates from how the FDA approved the drug, then it is off-label. Now to the prescription of Trintellix, it is an on-label if it is solely used to treat major depressive disorder. And for its off-label use, Trintellix may treat generalized anxiety disorder or GAD. However, it must be noted that there are still limited trials on Trintellix for use in general anxiety disorder, so it should not be considered as the primary treatment for generalized anxiety disorder. For the efficacy of Trintellix, vortioxetine itself can be prescribed to diverse patients without dose adjustment, though the adjustment may still be done depending on patient's response to it. A study by Christensen et al. In 2020 shows that the short-term treatment with vortioxetine or Trintellix improved the anxiety, depressive symptoms, and overall functioning of patients with major depressive disorder. Long-term treatment also yielded the same results. While Trintellix or vortioxetine maintains a favorable safety profile, caution must also be exercised because of the side effects that are tied to it. This concludes my patient's education video on the antidepressant Trintellix. And please always remember to have thorough consultation with your healthcare provider before proceeding with any medication. Thank you.